Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Okay, welcome back to part 2 of our episode about the active form of coenzyme Q10 called Ubiquinol. It lowers the level of various scary results on a blood test that are connected with heart health. When these values are elevated, that's scary. When they're lower, that's good for the heart, it's good for survival, it's good for longevity, and it's good for being physically active and wellness. Hi, my name's Jerry Hickey. I'm a nutritional pharmacist. I'm also the chairman of the scientific department over here at Invite Health. So we spoke in the first part of this episode about how ubiquinol, the active version of coenzyme Q10, can lower inflammation in the heart, a factor called hsCRP, which is good because that clogs the arteries and it inflames the arteries, and it could make a piece of plaque rupture off and cause a stroke or a heart attack. So it's nice to have that low. And hsCRP is involved with many heart attacks. The two major factors tied into heart attacks in the United States are really high bad cholesterol and elevated inflammation in the heart. So adding ubiquinol to your statin drug is a really good idea because it lowers that inflammation in the heart pretty satisfactorily. Now, a second factor that we started to talk about in part 1 of this episode is Antiprobia BNP. Antiprobia BNP kind of tells you the health and the youthfulness of your heart. It could be part of your blood test, but it's not commonly included unless you have some overt heart damage like heart failure, or you suffered with a heart attack, or you have some serious disease of the heart. So they don't normally check it. I have it checked every couple of years. So doctors use this value in your blood test, Antiprobia BNP, to gauge the level of damage to the heart in patients with heart failure or other serious heart problems. But the thing is that research is now indicating that it also reflects the age of your heart, the youthfulness of your heart muscle, the strength of your heart muscle. And what I said in part 1, I think it really is applicable. You don't normally see a heart attack in a strong heart of a 40-year-old. You normally see it in a less efficient heart of a 60 or 70-year-old. So by taking ubiquinol, making the heart more efficient, by restoring proper metabolism and energy utilization in the heart to older people, is turning back the clock on an aging heart. And they see in studies that when you give people ubiquinol, when you bring up their ubiquinol blood levels, the heart responds and there's fewer heart attacks and there's greater survival. So I like all that. I like being here. I love my life. I love my wife. I love my kids. I want to be here. So I take my ubiquinol every day because I am, in fact, an older guy. So NT-Pro is a protein that you release from the cardiomyocytes, typically in the left side of your heart, the part that pumps oxygen-rich blood around the heart. Cardiomyocytes are like the action cells in your heart, the ones that pump the blood. So you continuously produce small amounts of Antiprobia BNP, so you always see a little bit in your blood test. But when the heart senses that it needs to work harder, it releases more. And so a true elevation of Antiprobia BNP, like a young person, their Antiprobia BNP might be 16, and somebody with heart damage, it might be 200. So doctors use it to gauge the seriousness, the severity of damage to the heart. But they also use it to see if it goes down when they're giving drugs, to see if their medical treatment is working. So it's an important factor in what we call heart failure. Now, heart failure is actually a misnomer. You know, just like they called a tsunami a tidal wave. In heart failure, the heart still pumps blood. It's just harder for the heart to pump enough blood for your needs. So when the left ventricle, the part of the heart that pumps oxygen-rich blood throughout the body, is having difficulty pumping sufficient amounts, the concentration of Antiprobia BNP in the blood increases pretty markedly. It can really zoom up And this may occur with many diseases, actually, that affect the heart and the circulatory system. And this increase in the value of NT-proBNP in the blood test, it reflects the diminished capacity of the heart to pump enough oxygen-rich blood around the body. And you also see NT-proBNP increasing with age in all of us due to fibrosis, fibrous tissue building up in the heart, something that ubiquinol has been proven to minimalize, to decrease. So NT-proBNP is proving to be more useful than just looking at the heart muscle. Elevated NT-proBNP in a diabetic signals that they're more likely to suffer with a stroke or a heart attack, or develop severe damage to their kidneys or to their eyes, or develop nerve damage. That's according to a very recent study in the journal Diabetes. So let's look at the data on ubiquinol and NT-proBNP. So here's the first one. This is after heart surgery. It's the Division of Cardiology, University of Minnesota, and the Division of Cardiology, Minneapolis VA Medical Center. That's where the patients came from. It's in the journal's Annals of Vascular Surgery several months ago, April 2020. It's a double-blind, randomized, placebo-controlled human clinical trials. And before the operation, at the vascular clinics, the heart clinics, they were randomly assigned to CoQ10, very high doses, because you need a very high dose of CoQ10 to make some ubiquinol. They would have been doing much better off on ubiquinol, versus placebo for 3 days before the surgery. And they looked at things like NT-proBNP that would reflect the health of the heart. And then they also looked at the level of NT-proBNP up to 2 days after the surgery to see if raising ubiquinol levels really made a difference. So these people had ischemic heart disease, poor circulation to the heart, where they got chest pain, they had congestive heart failure, they had suffered with a stroke, a lot of them had diabetes. These people were suffering. And they found that NT-proBNP really, as ubiquinol levels in the blood went up, NT-proBNP levels dropped. So it really meant something. And 24 hours following the heart surgery, this is heart surgery, okay, like replacing the valve in the heart, the patients with elevated NT-proBNP had a much higher incidence of damage to their heart tissue, myocardial injury, and a longer stay in the hospital. And this was compared to the patients with lower levels of NT-proBNP. And once again, you could tie that directly in there. The higher the level of ubiquinol, the lower the level of NT-proBNP. So here's a study documenting that. It's in the journal Biofactors. It's the Institute of Human Nutrition, Christian Albrecht University up in Kiel, Germany. That's in northern Germany. It's almost 900 elderly people, but they're healthy. They're not institutionalized. They're not in a nursing home. They're living at home. They're living at home with their family or their own apartment or their own house. So these people are getting around. And they looked at the level of ubiquinol and the level of NT-proBNP. See, there's a ratio of traditional CoQ10 that you buy in a health food store to ubiquinol. And it's generally, in a healthy person, 25% ubiquinol, 25% CoQ10 to 75% ubiquinol. And they found in older people, higher ratios of ubiquinol to CoQ10, in other words, having sufficient ubiquinol, was directly correlated with a lower level of NT-proBNP. In other words, their hearts were younger and stronger. That's what it means. Now, when they compared healthy subjects to heart attack patients, heart attack survivors had much higher levels of NT-proBNP and much lower levels of ubiquinol. So healthy people had lower NT-proBNP, greater ubiquinol. Finally, taking the healthy elderly subjects and giving them ubiquinol was tied into lowering the level of NT-proBNP, which was starting to take effect within the first 2 weeks. So here's a second study in the Scandinavian Cardiovascular Journal. It's the Department of Cardiology, Linköping, Sweden. And it's a 4-year, 48-month randomized double-blind placebo-controlled human clinical trial. And once again, these are healthy older people living at home. They're not institutionalized. We would call that community dwelling. Their mean age was 78. So these were people in their 60s, 70s, and 80s. 443 of them they gave them selenium with ubiquinol. So why would they give them selenium? Selenium is missing in the soil up in Norway, Sweden, and Finland, and that can lead to damage to the heart. So they wanted to rule out any effect of selenium, so all these people were put on selenium. And then they put some on ubiquinol and some on placebo. And they found that raising ubiquinol levels lowered the level of Antiprobia BNP. It significantly reduced Antiprobia BNP, but it also significantly reduced the risk of dying from something related to the heart, a heart-related event like a heart attack or sudden cardiac death, pretty dramatically over the 4-year period. A number of studies are showing that, by the way. When you give ubiquinol, you're turning back the hands of time in the heart, you're reversing aging in the heart, and people have fewer heart attacks. I mean, it's a very, very important supplement. So here's the journal Aging. It's doctors in different clinics and hospitals and academic research institutions in northern Italy. And they want to say I'm paraphrasing, in older patients, the heart is less efficient. Performing surgery on their heart often leads to further declines in the performance of the heart. So you're doing surgery on their heart to fix them and keep them around, but this further gums up the function of the heart. So they said one way to measure damage to the heart related to heart surgery is testing the level of troponin 1, which brings me to the last value that we're looking at. Troponin is a protein in the heart. There's troponin 1 and troponin T. And when the heart is damaged, the heart releases both of these proteins. Similar causation, similar things cause the release of this, damage to the heart, and you get a similar release of either one, either troponin T or troponin 1. In other words, you don't have to test both in the blood test. You test either troponin T or troponin 1. So 50 elderly patients with severe aortic valve stenosis, the valve of the heart was damaged. Valves in the heart prevent the blood flow from going backwards. And what this does, this narrows the heart's aortic valve. So they underwent aortic valve replacement surgery, so it's heart surgery. So they were given placebo or they were supplemented with ubiquinol for a week before the surgery and for 5 days after the surgery. And what they found is ubiquinol prevented an increase in troponin 1 related to the heart surgery. So the troponin 1 in the placebo group went up to 4.3, that would be nanograms per deciliter, 4.3, whereas on the ubiquinol, the troponin 1 only went up to 1.9. So it really helped prevent an increase in the troponin 1, indicating that the ubiquinol was protecting the heart during heart surgery, valve replacement surgery. That's a very important finding. So here's elite swimmers. When you do intense exercise, you put a lot of stress on the heart. Strenuous exercise causes some damage to the heart and a release of troponin 1. So this is 36 elite healthy men who are swimmers with a mean age of 17, so they're very young. And it's an 18-session protocol. And they found out if they gave them ubiquinol, it prevented a modest increase in troponin 1 and creatinine kinase levels. Creatinine kinase is in your muscles, and when the muscle is damaged, you release creatinine kinase into the blood. It indicates that there's damage to the muscles. So giving ubiquinol is preventing an increase in creatinine kinase and preventing an increase in troponin 1. So here we have evidence that 3 major risk factors showing that there's damage to the heart, which is extremely dangerous, hsCRP, troponin 1, and Antiprobia BNP are all reduced by taking ubiquinol. I do recommend ubiquinol. I take it every day. There happens to be heart attacks in my family. I'd rather not have one. Just a word, always take ubiquinol with food. Ubiquinol is much better absorbed than regular CoQ10. The CACO2 cells in the intestines have a much stronger preference for ubiquinol than they do for CoQ10, so it's absorbed like 5 to 10 times better naturally. Ubiquinol by Kanika is the only coenzyme Q10 made in America. It's the only natural Coenzyme Q10. It's the only active coenzyme Q10. It's the only antioxidant version of coenzyme Q10. The other versions that you typically get, called regular CoQ10, they're actually oxidized. Not a good idea. So because you have to convert them to ubiquinol before they do anything. So who would benefit from ubiquinol? Every diabetic. Diabetics have a very difficult time changing CoQ10 into ubiquinol. And see, diabetes is not just a disease of sugar, it's a disease of metabolism. It's also a disease of blood fats like triglycerides and cholesterol. It's a disease of energy production, so ubiquinol really helps them. There's a lot of studies on this. Other people that would benefit from ubiquinol are aging people, because when you hit your 40s, you start to make less and less ubiquinol. It starts to mean something in your mid-50s. So I usually recommend people start on ubiquinol by about the age of 55. Athletes benefit from ubiquinol. It's a great supplement. And anybody with damage to their heart benefits from ubiquinol. Always take ubiquinol with food. Just a tip. Some companies add titanium dioxide to their supplements. Titanium dioxide is the stuff that makes white paint white and shaving cream white. Do you really care if your shaving cream is white or creamy colored? I mean, does it really matter that you want to put this substance in there? Because titanium dioxide is a heavy metal. And they put it in supplements to hide the color of the supplements. And the problem is that titanium dioxide is a heavy metal that damages your intestines, the lining of your intestines. You literally develop leaky gut syndrome. Not a good thing. So when you go out and you buy your CoQ10 or your ubiquinol, commonly they add titanium dioxide to those supplements. Make sure they didn't add it. If you have a supplement at home with titanium dioxide in it, either return it or throw it in the garbage. Don't use it. And like I said, always take your ubiquinol with food. Thank you for tuning into the Invite Health Podcast. You could find all of our episodes for free wherever you listen to a podcast, or you could just go to invitehealth.com/podcast. Please make sure you subscribe. Please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you next time on another episode of the Invite Health Podcast. And let me just say something. If you have a question on anything I said, I'll give you 2 email addresses. One is an address where we put 5 of our nutritionists on it. It's nutrition@invitehealth.com. And there's also my email address, jhickey@invitehealth.com. So thank you for listening.